I'm Dr. Lisa Palmer, Dr. Mama Bear, coming to you live on depression, dermatology, and decisions. Actually, this is a very special broadcast tonight, if you will. My mother's birthday is on Thursday, and so I wanted to, I don't know about you guys, but you can let me know, one, if you can hear me, and two, what the heck do you get your parents for their birthday, right? What do you get them? I have trouble on the holidays, I have trouble on birthdays and stuff like that. And so I was thinking about my mom, and I was thinking about how proud I am of her, for the challenges and the barriers that she's pushed through and what she's done. She'll kill me if I tell you how old she is or how young she is. We'll say it like that. But the things that she's done in her career. And so, this, mom, is your birthday present. I love you. I think that I don't think I am so proud of you. And I wanted to share a little bit of your story and with hopes that maybe it'll inspire someone else tonight. And so, um, mental health is a challenging topic. There are some people that believe that it is genetic. There are some people believe that you're just kind of screwed with certain conditions. Hi, Robin. Hey, Dr. Dalen. There are people that they'll say, well, I'm an anxious person because my grandma was anxious, or I'm depressed because it runs in my family, or I'm whatever because of this, or my school counselor diagnosed me with ADD or ADHD. There's actually a thick book called the DSM. I forget what number they're on. And it's a book or a manual, if you will, of a whole bunch of different mental disorders. And there's crazy stuff there. And they're like, there's, if you like to shop and you own multiple credit cards that you can have a shopping disorder. If you like organic food and you prefer to only eat organic food, the psychiatrist will label you with a organic food disorder. If you have certain beliefs, there's different questionnaires that they fill out, and then they label you with whatever, and they put you on psychiatric drugs for forever, right? So my mother, when I was a kid, I was emergency C-section. She woke up at 3 o'clock in the morning. My umbilical cord was not in her anymore. She wrapped the umbilical cord up in a towel, woke up my father, knew enough as a nurse not to put pressure on that. And he drove super, super fast to Baptist Hospital in Miami, and an amazing surgeon. So some people think as a holistic doc that I don't like medical docs. That's not true. I have friends that are medical doctors, nurse practitioners. My mom was a registered nurse. And I'm very, very, very thankful for the medical doctor who did emergency surgery, emergency C-section on my mother and saved my life. They gave me 5% chance of making it. And for a while, they called me the miracle baby, right? So I just figured I'm here for a reason, and we have a purpose and a mission. And a lot of you guys feel the same way, that we have a mission and a purpose. Well, there's belief that once you cut open the uterus, once a C-section, always a C-section, because cutting open the uterus does weaken the uterine walls. You can have a VBAC, meaning that someone who's had a C-section can have a healthy vaginal birth. But some docs don't want to go there because that uterine wall was cut through. So my sister was not an emergency C-section, but she was also a C-section. And in Chinese medicine, the meridian, the middle of the body, has a lot of energy flows, right? So we have energy flows in our body. Those of you that go to an acupuncturist, you're aware of that because it's where they put little needles. Those of you that go to doctors of chiropractic like myself understand that the nervous system has energy patterns in it as well. And so when you have an incision or a cut on the midline of the body, that can negatively affect the way that your nervous system functions. The nervous system controls, through your brain and 31 pairs of spinal nerves, controls every single function in your body. Think about what you had for dinner. Your nervous system is telling your stomach to secrete stomach acid to break down proteins. It's telling your bile, it's telling your liver to secrete bile to break down fats or neutralize the stomach acid. It's telling your small intestine to absorb the nutrients. It's telling your large intestine to absorb the fluids, right? And then it makes poop and then you poop, right? So any type of disturbance such as a incision in surgery, a cut, a tattoo, a piercing, a scar in the midline of the body can be very, very damaging. And so my mother, with back-to-back C-sections, one for me and one for my sister, had that center part of her body where her uterus is located cut open 2 times, right? And I think they even went over the same scar. And so, in nutrition and holistic medicine, we link scars to certain problems. So, some people can have scars, so they've had an old surgery and the scar is still itchy. Sometimes that's an indication that there's a bug or a chemical or metal stuck in there. I had a scar on my face that you couldn't see from falling off my bike, that when that scar was activated, made me nauseous. And scars in the midline like that, C-section scars, can make women feel depressed. So after you have a baby, a whole bunch of hormones are changing and increasing and decreasing, and your body kind of went through the hardest athletic event of your lifetime, and you could feel sad. And so I will admit, after I had Leah, I had a day where I felt sad. I felt like I was a bad mom. I felt like she didn't like me, even though she was an infant. It was just kind of a weird thought. And luckily, my husband, doing a holistic nutrition work, found out that my where I had tore those stitches, that scar, if you will, was messing up my system, was in the midline, right? And so by applying what we have, a cold laser, I had one in here. Where did it go? I thought my cold laser was in here. I'll find it after I get off with you guys. But applying cold laser, or by applying organic vitamin E topically, I went from sad, thinking I was a bad mom and postpartum depression, to totally fine in a matter of minutes, right? My mother didn't have the knowledge that I had, and she was sad after the birth of my sister. I think due to that C-section reopening. Nothing against my sister, nothing against her or anything. And then she was put on antidepressants. And so once you get put on antidepressants or any kind of those psychiatric medications, it is very, 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 very difficult to ever stop them. The side effect, if you're interested in looking up different medications, you can go to drugs.com, and drugs.com will tell you the side effects of different medications. And so every single antidepressant that I've ever researched, the side effect is always depression. It is many times anxiety. It is many times suicidal thoughts. So throughout my childhood, my mom suffered, if you will, with depression, and she saw a psychiatrist, and she tried to come off the antidepressants, but they rebound. You have to be extremely careful trying to even decrease those kind of medications, let alone come off them. I do not recommend doing that on your own. You need to work with a physician, and most physicians still try to remove people too quickly. And so she had trouble. She had a lot of trouble. And then, as fate would have it, so you can believe in fate or luck, I believe in moving towards your mission, right? I started researching applied kinesiology when I was in chiropractic school. So it's a form of muscle testing to figure out what's going on with the body. And then studied nutrition response testing and learned that scars on the middle end of the body can cause issues. So then we started working on my mom's scar. We started helping to balance out her body. She started having wins. She lost like 50 pounds. Her doctor was able to decrease her medication. Now, update to today, excuse me, she's not on any medications, to the point where she'll go to her medical doctor. Anybody want to do a shot of bore with me? Yeah, so Jonathan, I almost called you Dr. Jonathan. Jonathan's reminding everybody it's a full moon tonight. And I just felt like having some bore, which can help. It has some cool stuff in it, like sweet wormwood, which will handle buggies, Japanese knotwood, milk thistle, which is great for the liver, teasel root, which is really good for patients with Lyme, turmeric root, which is great for inflammation. I mean, this one product has so much stuff in it. So I'm gonna go ahead and have a little dropper full. It's a brown liquid. It does not taste good, but I wanted some. So Robin had her Barton Pear 3. Hey, Amanda. And so I won't tell you how old she is because she'll get mad at me. And I want her to watch this because I'm so proud of her. She's not on any medications. So when she goes for her annual physical, because Medicare wants you to, she gets blood work done, and the nurses don't know what to do with her. They're like, "You're how old?" And she says, and they're like, "And you're on what medication?" And she says, I'm not. And they're like, "Well, what are you supposed to be taking?" And she says, "I'm not." And then, yeah, I mean, I think I'm gonna have another shot of Isbor. You done some extra para 3, and they're shocked to see someone in her age range. So let's just say Medicare eligible, so she has to be at least 65 for that, right? And on no medications. And so I'm so proud of her because not only did she overcome the depression, not only did she help her body heal with natural means, whole food supplements, homeopathy, changes in diet, but she loves the work that we do so much that even though at the time she was in her 60s and in nursing, she had worked at a big public hospital in Miami, and then when she moved up to Central Florida to be closer to me, she fell in love with the nutritional work we were doing. And she actually worked in the office with us with patients for a long time. I want to say like 10 years. And the only reason why she stopped is that's when my father had some issues and she started helping him. And so she was great with patients. I'm so proud of her because I can't imagine being in the nursing field for, at the time, I think she was like 43 years into her career, and then she realized before this, but realized that like nursing was just chasing symptoms and medicating people and cutting things out of people. And she would make recommendations like, "Hey, why don't you try some homemade chicken soup? Why don't you try some ginger? Why don't you try some turmeric?" And the medical doctors actually told her at one point, when she was doing home health, she says, they told her, "If you keep recommending natural things, we will no longer have you as a contracted nurse. Like, we will fire you." And I just thought that was horrible. And it was a lot of nurses that are aware of what the medical scene really is like. And either the nurse patients that I have are either amazing patients and they know healthcare is broken, or they're really stubborn patients and they're a pain in my butt, just being real. So the ones that know that healthcare is broken, and want to help fix it actually come over and start learning quantum nutrition. So I've trained some awesome nurse practitioners. I've trained some awesome medical doctors. I've trained some awesome registered nurses and OTs and PTs and stuff like that, because I appreciate them. I trained a medical doctor this weekend in Tampa, and I super acknowledged her and appreciate her because it's one thing to be a chiropractor or acupuncturist or massage therapist or a doctor of oriental medicine or a naturopath and already be over here in holistic land. It's a whole other thing to be trained in medical land, see that they're not finding the cause, and I'm not talking about emergency medicine. I'm talking about healthcare, right? Like your general practitioner, your general, your primary medical doctor, right? See that this way is broken, see that traditional medical healthcare, if you will, is broken, and then jump ship from this land that you got trained in and move over here to holistic land. I really, really admire people that do that. And so with that, I really, really admire my mother because she could have stayed in traditional nursing. She could have stayed working for the various different places she worked for. She could have said, well, because I run into nurses that do this and medical doctors that do this, is, "Hey, I'm going to give medicine and surgery and whatever to my patients, but then for my family, I'm not going to do that to them." It's kind of like the pediatrician that says, "Well, vaccines, you need them for you, patient, but I'm not going to vaccinate my own kid." Well, if you wouldn't do it to your own kid, why would you do it to someone else's kid? Like, that to me is an integrity and ethics problem, right? And so my mother was brave enough and later in her career to learn a whole new way of holistic healthcare to practice muscle testing to go from nursing, where she assisted in surgeries, she worked in dermatology, radiology, ER, um, immunocompromised, breast health, work in those fields, and then totally have a career change into holistic healthcare and work with us at Palm Rancho Health. And she didn't just work with us, she pulled 40, 50-hour weeks. And I'm like, Mom, you don't really have to work, like you don't have to work that hard. You could work like part time if you wanted to. And she was pulling crazy hours that we were pulling in her 60s. And I was like, damn, Mom, like I'm impressed. And the reason why she did it is because she was so on purpose, right? So, like, when you have a purpose and you have a mission, you do not get tired. You can physically get tired, right? So, sometimes when I'm teaching, my feet will hurt because I stand for 2 days straight. But your soul, and you guys can comment on if you feel like this, but your soul is replenished. Your purpose is refueled. Your cup is refilled. You're like, all right, let's go. Let's go again. Let's help more people. And so if I ever have a challenging day in practice, it totally turns around again, because my next patient is someone who is doing great and they're thankful that we're helping them and all that. And when it's a challenging day, it's usually someone who has made some previous choices that have caused some problems in their health. Lately, it's people that have made some choices with bioweapons that I can't undo. No one knows how to undo that right now. And so when my mom worked in dermatology, it was kind of like, squeeze that, like my mom was like Dr. Pimple Popper before Dr. Pimple Popper was a thing. She would tell us at the dining room table. And my poor brother-in-law did not grow up in healthcare. So he was mortified to hear the stories that both my parents, because my dad was an executive in the hospital and my mother was a nurse. So they would talk about cases. And my mom would talk about some of the most disgusting things that I don't think twice about. When she worked in dermatology, she would talk about like being Dr. Pimple Popper. She'd squeeze out abscesses and blackheads and freeze off warts and sew up this and like, dude, disgusting stuff. Because in dermatology, if there's a problem, what do? They cut it out. If there's an infection in the skin or a rash in the skin, they give you antibiotics. If it's all red and inflamed, they give you steroids, right? And once I had a dermatologist, I was so excited. I had a dermatologist in my holistic class. And I asked her, I said, hey, when someone comes into your office with eczema, how do you know what to do? And she goes, well, I look at it, and typically with eczema cases, I'll give them an antibiotic. And then I'll have them come back in 6 weeks. And if it's not any better, then I might give them a different antibiotic. And then I have them come back in 6 weeks, and if it's still a problem, then I'm probably going to give them a steroid. And then if that's not any better, then I'm going to add in this and this and this and this. And I'm thinking, oh my gosh, like basically you're telling me you're guessing. Like you're guessing based on what it looks like, and you're guessing on what you should use. And she's like, yeah. And I'm like, oh my gosh, it's a field of like gambling, really. Like you flip a coin and you guess what you think the patient needs. And I was like kind of horrified, actually. And so I was teaching her muscle tests, and I said, what's so cool is now in muscle testing, you can connect with the innate intelligence of that person. It's almost like hooking up EKG leads to somebody's chest. When you're hooking up those electrodes, you're not shoving it into the chest, right? It's topically on the surface of the skin. And the electrodes pick up on the electricity of the heart, translates that into a signal, translates that to the printer or the computer program that makes it into a graph, right? But the electrodes are not on the heart. It's picking up the frequency from the heart. So when we muscle testing, we're looking at the frequency of the organs, we're looking at the frequency of the glands, and we're comparing it to the frequency of the causes. The causes could be something that they're eating. It could be a chemical exposure in the water that they drink, in the air that they breathe, and the food that they eat. It could be a heavy metal exposure. There's a lot of radioactive elements that are found in the water supply. It could be some kind of pathogen or bug. It could be stress. It could be all of these things together. It could be mold, right? It could be fungus, could be yeast, could be candida. And so with what we do at Palm Natural Health is we do what's called quantum nutrition testing, and we look for the cause. So when I was teaching this dermatologist, I'm like, how cool would it be for me to teach you how to muscle test your dermatology patients? And you can look at the frequencies and not diagnose them, but see if possibly that's a candida problem, or possibly that's parasitic because there's parasites that can live in the skin and cause eczema. Or maybe it's mold, or maybe it's a toxin, or maybe it's a food that they're eating, or maybe it's multiple causes. Then instead of suppressing the symptoms with an antibiotic, which, oh, by the way, will kill off good bacteria too, and takes 7 years to rebuild the microbiome, then you could figure out what whole food supplement, what herb, what homeopathy would balance out that patient's skin. They get better. And so, Robin, I totally agree. A dermatologist muscle testing would have been epic. And yes, I said would have been because you know what happened? Unfortunately, she said, I can't do this. And I said, why not? And she said, what would my peers think? And I said, they probably think you're pretty freaking cool and wonder why you're getting great results in cases that they're struggling with. And she was too concerned what her peers would think about her muscle testing that she didn't carry on in her training and she didn't utilize the technique that I taught her. What an unfortunate thing. She could have helped. I mean, we get cases of little kids with eczema that want to scrape off their skin, and actually their parents put them in mitts because they're scraping their skin raw. My mom, when we started to help her detox the effects her, because every single medication has a chemical or medical component. And so not only are you handling the negative component of side effects, but you're also handling the negative component of the contents of that medication. It could have chlorine, it could have fluorine, it could have bromine, because that will help bypass the liver and get straight into the system. And so many medications will have chemicals and metals, if not all of them. Actually, I would be bold enough to say they all have it. And so with my mother's case, as we're detoxing some of these nasty metals from medications and other sources, she was having a tough time, and some of it was coming out of her skin. Now, that was before we had the cell core line. So I think if we had the cell core line, that would have been way, way easier. But the third part of what I wanted to talk to you about is she had to make the decision as a nurse. She's trained in nursing. Can you imagine being in your career 40 years, right? It's almost double what I've done. 40 years, you've been trained in everything medical, IVs, popping pimples, cutting things, sewing things, assisting in surgery, um, dispersing medication, or dispensing, I guess is a better word, dispensing medications, all of these things. And so 40 years into her career, she had the decision. She could stay in that field that she was extremely comfortable in, and that she understood nursing. She understood how nursing floors work. She understood the different disciplines and principles of nursing. She went to nursing school back then when they made you do hands on training. Some of the nursing programs now seem that they're more theory, and the nurses are coming out of school with less hands on experience. And so she had the decision. She could stay in comfortable land. She was nearing retirement. She could have had added to her pension. Or does she leave comfortable nursing land she's been in for 4 decades and jump into a crazy holistic world? And I'm so proud of her. In her 60s, she did not have to do more training. She did not have to change careers. She did not have to continue to help people. She didn't even have to work. I'm so proud of this woman who, if you ever worked with her, she is the most caring person. She is the sweetest person. She greets you with a smile. She just like, some of her patients that she started, we still work on. I actually saw one today that asked me every single visit, how is my mother? So that's the impact that she has on people. And so I'm so proud of her that she saw the brokenness in healthcare and medical healthcare, changed to her career in her 60s, learned how to muscle test, because you don't learn that as a nurse, learned how to muscle tests, learned instead of all about medications, learned about whole food supplements, attended almost as many seminars as I did, and then worked as many hours, some cases less, some cases more than I did to help her patients heal naturally. Like, how freaking cool is that? So, Mom, hopefully you watch this. I just wanted to say publicly, I'm so proud of you. I'm so proud that every single day you continue to learn more. So she still is attending webinars. She is still learning about products. She's still working on her own health. She helps my father. She cooks organic food for him and themselves. Because a lot of people in her 60s, and she's told me she has friends that a lot of her nursing school roommates and buddies, they're on the laundry list of medications. And some of them have cancer diagnoses, and some of them have passed away. And they're all the same age. And then some of her friends in her age range are in wheelchairs and they don't really do much and they definitely don't work. They sit in front of the TV and they just kind of exist. So, you have decisions whether you want to get into natural health care. You have the decision to do that and learn. And I'm happy to teach you in our Quantum Nutrition Academy. If you're locally and you want to be on a on purpose team on a mission to change healthcare, to help our future generations be able to have kids of their own, to be healthy enough to do that, to change it from sickness care to wellness care, to change it from when in doubt, cut it out, to what's going on with this organ and gland and how do we get the body to heal itself, to instead of suppressing symptoms with a steroid or a pain medication or whatever, okay, why in quantum world, why is that symptom there? What is the cause of the symptom? And then we're not treating or diagnosing or curing, we're rebalancing the body with natural means to help the body handle the toxin, to help the body get rid of the pathogen, to help the body rebalance into a healthy state and continue to improve in that healthy state. So I'll read a couple chats, and if you have questions, let me know. So Heather is saying, "What's in the dropper that you're taking?" I couldn't read the bottle. So Isbor is a cell core product. So it's got stuff like different herbs like sweet wormwood, Japanese knotwood, milk thistle, wormwood leaf, burdock root, black walnut hull, teasel root, yellow dock root, devil's claw root, turmeric, white willow bark, elithra root, boneset stem, sheep sorrel stem, cat's claw bark. So this is a powerful formula with a lot of good immune boosting herbs in it. And so it is a full moon tonight. Pathogens, especially parasites, like to be a bit more active because they respond to a lunar cycle and tides. And so, sometimes around those, I'll take some extra bore if I feel a little run down. My daughter, so I'll give you an epic parenting fail. I was teaching for Cellcore this past weekend, and typically I bring someone to help me watch her. But one of my friends, her daughter was also there, and they were there. So I figure, okay, well, I'm teaching only a couple sections between me keeping an eye on her and my friend keeping an eye on her. We're all good. But my daughter was really, really, really sneaky. And so she loves to drink herbal tea. This hotel, for whatever reason, didn't have herbal tea. So she was drinking caffeinated tea. And so I said, okay, well, you can have a little bit of green tea, but that's it. And she took a little bit of green tea to started drinking coffee. And so my daughter drank coffee this weekend. So I'm embarrassed to tell you, she drank multiple cups of coffee. She was super hyper. I kept her hydrated and well fed. So I really didn't notice any kind of major changes. But what happens is if you drink caffeine, and a higher amount of caffeine 2 days in a row, and then the third day you drink nothing, you get this nasty thing called a caffeine withdrawal headache. And so my daughter had a horrible headache last night. And she admitted that she did not drink herbal tea, that she was filling coffee cups and multiple cups. So, as a parent, admitting to you, mommy fail, right? I should have had someone come help me watch her. I should have sat in the back of the class, which I normally do, and I changed my policies. So, I'll have to change them back again to how we normally handle this. And she drank caffeine and she paid the price of drinking that. Like she had a headache from it, right? And so I didn't get a lot of sleep last night because I was worried because her head was hurting her. And, you go into mommy mode and then you hear them make noises at night. And then, of course, in our backyard, we had to have an owl decide to sit in one of our trees in the back and screech. So I don't know if you guys have ever, the moms in here probably understand. I would wake up like, ah, and it was a stupid owl, but it sounded like she was crying. So I didn't sleep a lot. I'm a little, a little run down today. So some extra bore will help me with that. And then, of course, I'm probably going to go to bed after I hang out with you guys. So Heather says, I've been in the medical field since early 90s COVID years. Have opened my eyes even more, leading me from nursing career to holistic world. Awesome, Heather. If I can help you train in the holistic world at all, please reach out. My online training and live classes is qntacademy.com, and I'd love to help you. Let's see, Lucy Lacey. Hi, Lucy. Yes, 2019 was a huge eye opener of being a nurse. I had to leave because my spirit was so conflicted. How can I live with myself knowing I'm contributing to causing people harm? So well done, Lucy. You have integrity. There are people that know that it's not right and they do it anyways. And to me, that is not okay. Sonia says she feels the same way. So again, well done, Sonia, because you guys could have just kept doing the same thing, because it does take someone with integrity. It takes someone with ethics. It takes someone with responsibility. It takes someone with a soul to see something that's wrong and to do things to not keep doing that. What about the patients? What about the patients? I'm sorry, Robin, I don't know what the question means. Paulette says they end up on steroids, ruin their adrenals and immune system. Yeah, so in dermatology, they just get more and more and more medications. I have a case where a gentleman had redness and itchy skin on his face, and he's been in dermatology, treating with a dermatologist for 10 years with no improvements. And so we found some parasitic immune challenges, some mold challenges. We're handling that, and his skin is clearing because we're handling the cause. Let's see. Paula says I can so relate. Heather says I have his bab. Cool. Heather says I'm planning to sign up and come to your next level 1 class. Yay, Heather. I can't wait. That's so awesome. Heather, on March 15th, if you're friends with me on Facebook, keep a lookout. We're going to have a webinar on a sneak peek into our level 1 and level 2. So you guys are all invited. And Amanda says, I'll see you there. Oh, cool, Amanda. So Amanda's traveling all the way from Canada to attend our level 1. That is awesome. That is very cool. All right, everyone. Well, if you do see my mother, please wish her a happy birthday on Thursday on social media, or if you're local in Florida here. I hope that if you are suffering or someone you know is suffering with depression, there is hope for them. There are things that can be done about that. If they're suffering from horrible eczema, skin rashes, pimples, cystic acne, boils, whatever, warts, plantar warts, there's things that can be done about that to figure out why. And then if there is decisions that you need to make, I encourage you, if your soul is screaming, stop doing this, I'll encourage you and kind of lightly shove you in a different direction. That it is so rewarding in life to follow your mission. It is so rewarding in life to help people naturally. It is so rewarding in life to see people heal from chronic conditions and diseases when you help their bodies rebalance. So thank you guys. Yes, Amanda, I'm going to go to sleep right now. I'll get some rest, take care of myself so I can take good care of patients tomorrow. But thank you guys for joining me tonight. I'm Dr. Lisa Palmer, Dr. Mama Bear. Good night, everyone.